You are watching EKG video tutorial 5.2 on the corrected QT interval. Recall that the QT interval includes the entirety of the QRS complex in whatever form it comes, the ST segment, and the entirety of the T wave. Consequently, it represents ventricular depolarization and repolarization. When we take a measurement of a QT interval, we want to begin at the very beginning of the QRS complex in whatever form it takes, and then complete our measurement after the T wave has returned to isoelectric baseline, that is the flat portion. We're going to use the longest that we can find, and we need to keep in mind that heart rate is inversely related to QT interval, so that as the heart rate goes up, the QT interval is going to become shorter. We always want to use the corrected QT interval just for this very reason, so that we can adjust for variability in R to R intervals. We can take the measured value and plug it into Bazet's equation so that the corrected value will be the product of the measured QT by the square root of the R to R intervals. Usually the computer program can do that for you fairly nicely. Now there's no true normal range because of variability, but to kind of hang my hat on a value to give me a sense of what's going to be really high and really low, I like to say that 0.44 seconds is kind of an anchor value, so that prolonged values are going to be in the 0.5s, 0.6s, 0.7s, and it is possible to have a short QT interval. On the right you can see the case of hypercalcemia. The corrected value is 0.36. This can also occur in hypothermia or digitalis toxicity. There is also an inherited short QT syndrome. This is thankfully rare, and so we won't be spending any time on that. We are mostly concerned with the effects of a long QT interval. Recall that the ventricular depolarization phase of the cardiac cycle is electrically vulnerable. If we see here, for example, we have a normal sinus beat with a P wave, a QRS complex, and then this prolonged QT interval. If a premature ventricular contraction shows up and has the R wave land on the T wave in that vulnerable period, it can precipitate a ventricular arrhythmia here in the form of torsade. Patients with prolonged QT intervals have a prolonged vulnerable period, and so they are at increased risk for sudden cardiac death as a result of these ventricular arrhythmias. For the most part, EKG computers do a pretty good job in measuring and correcting the QT interval if there is no arrhythmia or AV block associated. Nevertheless, I like to do a quick eyeball check on all of my EKGs. What I'll do is find two R waves and then draw a line between those. Then I'll draw a line perpendicular to the initial line in a way that completely bisects it in two equal halves. If that line comes down and punctures any part of the T wave, then we will conclude that the QT interval is indeed prolonged. And the good thing about the eyeball method is that it does adjust for the R to R variability. Long QT intervals can be acquired or inherited. On the acquired side, we have the usual toxic metabolic customers, antiarrhythmics, and even common antibiotics and antipsychotics, as well as low calcium, potassium, and magnesium. Interestingly, we do see prolonged QT syndrome and ST segment abnormalities in cases of intracerebral hemorrhage. In the panel above, you can see a patient who underwent EKG, and their baseline study shows a normal QT interval. After they were prescribed amiodarone, you can see that their QT interval prolonged significantly to 0.54 corrected. Here we can see an unfortunate case where a patient on quinidine experienced long QT syndrome with subsequent torsade de Pont. You can see here this is a very prolonged QT interval. Now on the inherited side, there are specific gene mutations and associated phenotypes. We don't need to know anything about that so much to know is if we have a patient in whom we suspect inherited long QT syndrome, that they need to be under the supervision of an electrophysiologist. Here's an EKG in a patient with hereditary long QT syndrome. And so we can look at their QT interval and see that it is obviously prolonged. Long QT intervals increase the risk of sudden cardiac death by polymorphic ventricular tachycardia as a result of that prolonged electrical vulnerable period. Although computers can do a good job in publishing corrected QT intervals, I always like to do a little eyeball check and make sure that it matches up with what's being reported on the computer. In the case of acquired long QT syndrome, if it's one of those toxic metabolic causes, then we need to identify any electrolyte abnormalities, correct those, and then remove any offending agents. If we can think of all of those influences, electrolytes, medications, and then underlying tendency toward prolonged QT, all of those conditions present at the same time can set the stage for a tachydysrhythmia. On the inherited side, anyone in whom we suspect inherited long QT syndrome should be evaluated by an electrophysiologist. Next up is 6.0, increased chamber size.